So BioTe, I really like their method. They have a great method of calculating dosing that's individualized for each patient based on their age, their weight, their hormone levels. They have a lot of different dosing options, and I find it to be very consistent and easy to use. Sure. So the first thing would be to have an initial consult where we'll sit down and talk about your health history, how you're feeling, any symptoms that are bothering you, what your goals are, and then I tailor a program according to what is important to you and what you're looking for. And the next step would be to do a comprehensive wellness profile, which is blood work, looking at your hormone levels, comprehensive thyroid, as well as a lot of nutritional factors, inflammatory markers, things that help with the preventative aspect. And then we'd sit down and review your blood work, and I'd give you options on what we can optimize. And it's really up to the patient as far as how they want to proceed. If they do the BioTe, those are pellets. Pellets are basically the bioidentical hormones compounded into kind of like a tiny grain of rice that can be inserted into the fatty area of the hip. That gives you really, it's a very minor, easy procedure. It's pretty much painless. And it gives you continuous delivery of the hormones for about 4 months for women, about 6 months for men. Estrogen and testosterone can both be done that way. And then if you also need progesterone, which I generally also prescribe whenever I'm prescribing estrogen, that can be oral. Thyroid is oral. So depending on the hormones, there's different delivery systems that tend to work best. So I've seen really amazing results with just balancing people out with hormones and nutrition. Some of my favorite stories, I've had several people been able to come off of their antidepressants after getting their hormones optimized, which to me is very significant because antidepressants can really alter your brain chemistry and can be very hard to come off of. So being able to make that transition to a more natural approach to mood disorders, which tend to be very undertreated and poorly treated, unfortunately, I think this is a really great solution that needs to be more of a part of mainstream medicine. Also, there's so many people that aren't sleeping well. Sleep is so integral to brain function, to developing your own hormones. Normally during sleep is when we have a lot of those restorative processes. So getting people off of sleep medications that can have harmful, unwanted side effects and can also be addicting is another great accomplishment that I see very often with my patients.